Let's start with vomiting. Nobody likes it. And when it's your child that's vomiting, it is really hard to watch. Things to look out for: if your child is throwing up after everything they eat or drink, that's a really good sign to go see your doctor. Now, when you see your doctor, they're going to do a physical exam and get your history. And then they may tell you that this is a virus. So what does that mean? Well, viruses, they last for about 24 hours to a couple days. During this phase, your number one job is to keep your child hydrated. Don't worry about the foods. Fluids come first. Now, some tips for keeping your child hydrated. Give them small, frequent sips throughout the day. For me and my children, we've got something where we give them their sick water bottle. What this means for us is we have a special water bottle when they get sick, and we'll fill it up with water, Gatorade, electrolyte fluids, and their job is to sip through the fluid in this water bottle throughout the day. So that means when they're watching TV, they take a sip. When it's an ad, they take a sip. When it's a change of an episode, they take a sip. And so the goal is for them to refill that 2 or 3 times a day. Now, tip for you young parents whose kids still can't quite take a water bottle or who can't take a sippy cup. If you need to get out a syringe, then do the same thing. Do these frequent sips, and then give them 5 to 10 milliliters frequently. As your child's vomiting eases and they're able to keep down the fluids, go ahead and start giving them more food. Start with something easy, those bland foods, crackers, toast, bananas, stuff like that. Please stay away from spicy or greasy foods. And then as their appetite gets better, go ahead and increase the variety of foods that you're giving them. Now, the other thing that comes with vomiting is diarrhea. Diarrhea can be messy, especially for children who are still in diapers. This diarrhea can be harsh on the skin, and it can cause diaper rashes. Now, for a diaper rash, please continue your normal diaper rash care. Use barrier paste, the Desitin, butt paste, Aquaphor, Vaseline, things that help to protect that skin. And if after all this diarrhea is going on and you can't get rid of the rash, please come in. We'll help you manage it. Now, with diarrhea, it may last a few more days even after vomiting has improved. And so the key here is that as your child's diet returns, so too will their stool consistency. Now, when is it that you actually should go to the doctor or the ER? Well, the big thing is if you're worried about dehydration. Signs of dehydration include having 3 or less wet diapers during a day. If your child is crying, they should have tears. If they don't have tears, that's a sign of dehydration. Or if you see those dry, cracked lips, they may not be getting enough to drink. So if you're worried about that, please come in, see us. Other things to be worried about. If there's blood in the vomit or the stool, that's scary. Go to the ER. If your child has severe abdominal pain, especially that right lower quadrant abdominal pain, yeah, you need to get that evaluated. Let's go to the ER. And then if they seem more sleepy, more irritable, they're hard to wake, if you're just generally worried, yes, come in. Let's evaluate them. Now, as I said in the beginning, most causes for this vomiting and diarrhea is viral. So ways to prevent it: good hand washing, clean your surfaces regularly, and don't share utensils or cups. Most of these symptoms will improve within the first 1 to 3 days. And then the diarrhea may last a few more days after that, but it too will resolve. Now, I hope this helped you feel more comfortable when it comes to vomiting and diarrhea. Remember, hydration first, food later, and watch out for those warning signs. That's it for now. Stay healthy, and I'll see you later.